Good afternoon, everyone. I'd like to welcome everyone to Care Connection webinar. Today we have a very special. Her name is Rachel Wonderland, and she's the owner of By Day. And today's topic is going to be when it's time to move to a care community and what to do next. Before we begin, I just want to let everyone know that this will be in listen-only mode. So at the end of the presentation, everyone has the opportunity to type in questions or comments on the right-hand side under questions. So all questions will be taken at the end of today's presentation. So without further ado, I'm really excited to introduce Rachel Wonderland, and today's topic once again is when it's time to move to a care community and what to do next. Rachel, if you could please introduce yourself and then start the presentation. Thank you.
Sure. Hi, thanks for having me. My name's Rachel, and I'll have my links for the presentation during this as well. My website is Dementia by Day, and I have a book out actually on this topic called When Someone, about moving someone to a care community. It's actually the only book out there about this topic, which is interesting. And so I'm really glad to be working with Johns Hopkins in that capacity. So what we're going to be talking about today, if you have questions, go ahead, write them in, is when it's time to move somebody, how to make that move, how to make that transition without too much of a battle, and then hopefully, what to do when your loved one is in a care community as well. Okay, so we'll get started here. So care choices. So where can someone with dementia live, and when is the best time to move them? I find a lot of times that families actually do not know what their options are with regard to like care community living, where someone can actually go. Everyone just thinks, well, either they're in assisted living or they're at home. And actually there's a lot more than that. There are a lot more options than just that. The problem is you got to sort through these options, and you have to know what works best for you. So we're going to go through some of these today. The good news is that there's no one-size-fits-all answer, so that there are many options for moving somebody with dementia. The bad news is that you do have to decide what does fit best. The problem with this is that a lot of people that I talk to will say, well, mom doesn't want to move. Mom wants to stay at home. Bad news, it's not up to mom. If mom cannot make a decision about, what pants she's going to wear that day and how to make her food and if she should be driving, she can't decide what's best for her health care, and she cannot decide what's best for her living situation. So it's really up to you as the caregiver, and in some cases the power of attorney, to make that decision for your loved ones. So the bad news is, again, that you do have to decide what fits best, and you don't want to wait until the last minute. A lot of families will come to me when things have gone horribly wrong and say, oh, I should have moved mom before, but I've waited, and here's what's going on. Some reasons that you might move a loved one with dementia, obviously mental health reasons. So the main thing that we're talking about today, of course, is dementia. Dementia is a good reason to consider moving somebody to a care community or to consider having 24-hour home care, which we'll get to as well. People with dementia should not be home alone. They really should not be home alone. People with dementia are adults. They're not children. Children, you can, at some age, leave them home alone and say, look, don't invite anybody over, don't have any parties, don't get into trouble. You can't tell anybody with dementia not to get themselves into trouble. They're adults, they have years of life experience, and they're going to do whatever they want to do, and their memories are also impaired. So there's also that problem. We also have physical reasons. Your loved one may have trouble now walking up and down stairs. Maybe you live in a house with a lot of stairs. This could be a good reason that you need to consider moving somebody. You really do not want someone to fall at home. I recently went to somebody's house to do an evaluation, and she had a tub that her father had to step into. Super dangerous. I mean, this man had a lot of trouble getting around as it was, and stepping into a tub was not a thing that was going to go well. Behavioral reasons. You have a loved one who is having some sort of behavioral problems that you are not sure how to deal with. This could also be a good reason to move them as well. Familial reasons. So what often happens is that if it is your parent who has dementia and you have 5 siblings, if you're on this call today, it's probably because you're the one doing all the work. Usually there's one person who's the main caregiver and everybody else has a lot of opinions, but they're not actually involved in that person's care. That's usually how it goes. So familial reasons, a lot of times it falls onto one person's shoulders, and a lot of times that person ends up doing the brunt of the work. So they end up taking that person into their home, doing all the care, and that becomes too much work after a while. You know, again, people with dementia are not children. You know, it's not like raising a kid where eventually they're able to do things by themselves. People with dementia get worse over time, and the work will become harder for you. It will become more challenging, and it's not fair for one person to do everything. Distance reasons. I've met a lot of families whose loved ones live in a state that is not the state that they live in. So if you live far away from your loved one, it might be a good reason to think about care community living or some other sort of living situation so that you know they're being well cared for when you're not there to handle all of the care. Comfort reasons. This is important as well. It really depends on the person. So I'm an extreme extrovert, and I know that I would not want to live in a house by myself. Even if I had care staff coming in to take care of me, dementia or not, I definitely like being around lots of people. So I would do best in a care community environment. So you need to kind of know that person and know where they would fit as well. And then, of course, like I said, personal preferences. Where's that person going to be most comfortable, and where are you going to be most comfortable with that person living? Okay, knowing who they are as a person, knowing who you are as a person, and trying to figure out what they need. So here is a huge list of long-term care choices. So someone can live at home by themselves with home care. So if your loved one, you know, has a house that's bought and paid for, and they've lived there for 50 years, and you don't want to move them, they can live there by themselves, but you really need to send in home care 24 hours a day. I work with a home care agency around me in Pittsburgh, and many of the families that we work with only have care, you know, a few hours a day. And I'll go in and I'll see these clients, and I'll think, you know, oh man, this person really needs 24-hour care. Just leaving somebody at home by themselves is, you know, and saying like, oh, okay, this person's lived at home by themselves for years, they can keep doing it. No, that's not really a safe choice. It might make you feel less guilty, but it's not going to make that person safe. They can live at home with a family member or at home care. A lot of times I'll see family members move in with their loved ones in someone else's home with other family or home care. I've seen that as well. Daycare, adult, I hate the phrase adult daycare, but it really is what it is a really great setup for a lot of families. It's essentially a community. It's like community living, except for that person with dementia can go and stay for, you know, 6 to 8 hours a day at a daycare and get involved there, make friends, have stuff to do during the day, and make sure that they're safe and well taken care of in that community setting. And then at the end of the day, they go home. Assisted living or personal care. These are pretty much the same thing. I live in Pennsylvania. Pennsylvania has personal care, and I think there's probably like one other state that has personal care. Personal care, although they've tried to make it different from assisted living, is not really different. A lot of these communities as well have memory care, or as I like to say, dementia care wings, or dementia care piece of the assisted living community. Then you also have dementia care specific communities. So you have a standalone community that specializes in dementia care. Skilled nursing facilities. Skilled nursing facility is typically what people refer to as a nursing home. When you hear people say nursing home, usually they mean assisted living, personal care, dementia care, skilled nursing, independent living. Usually they throw that word around, but the word actually only refers to skilled nursing. Skilled nursing is often short-term rehab or long-term care. They have long-term care options at a lot of skilled nursing facilities, and this is typically for people with more physical needs. So if someone has, a feeding tube, something like that, they would not probably fare very well in assisted living or personal care. Skilled nursing has a lot of registered nurses, has a lot more nursing staff there, and so it's more well equipped for working with people who have more physical needs. They also often take people with Medicaid, whereas usually assisted living and personal care is often private pay. So that's another big difference, is skilled nursing will often take people on Medicaid. And of course, at the end of life, no one ever likes to talk about these things, but it's important to talk about hospice communities, hospice in home, or hospice at a long-term care community. And I will go into more detail about all these things as we go. So feeling guilty is really the ultimate caregiving villain, because so many people will come to me and say, well, I don't want to move mom. She says she doesn't want to move, so I'm not going to move her. It's not really a great reason to not move somebody, because I know people feel guilty. They don't want to make that decision for someone. I've had a lot of people say to me, well, so-and-so told me they never wanted to move into a home, never move me into a home. That's all fine and dandy, but when someone has progressed to the point in dementia where they need 24-hour care, there's no way that they would put that on you. If they knew where they would be in a couple of years, if they knew how much care that they would need, there's no way that they would put that amount of guilt on you and say, oh, don't move me. They'd probably say to you, if I need all this care, you absolutely need to do what you need to do. And so I'm kind of speaking for your loved ones when I say that, but I feel pretty confident in saying people that you're caring for do not want you to bear all the burden of their care. No one really wants to be a burden, or most people do not want to be a burden. So feeling guilty and not moving somebody is not really, it's not fair to them, and it's not fair to you. I'm not saying that you need to move somebody into a care community. I'm not saying that you need to do everything today, but you do need to consider your options, because not considering options is not an option. I also have had many people who move their loved ones into a care community where I'm working, and they'll come up to me. I had one woman who came to me almost every day, and she was so upset. Her mom was doing wonderful in our personal care community. She had pretty advanced dementia, and she was doing great. She had friends. She had lots of activities. She was very pleasant. But her daughter was so obsessed with this idea that she had betrayed her mother and said, oh, I feel guilty. I've moved her into a home. She said, never move her. And I said, well, you know what? Your mom's doing wonderful here. Your mom has a great time. The thing you'll also see is that a lot of times a resident in a care community will be doing great, and their family will come, and suddenly they're acting really upset, and they're telling their family, I want to go home. This is terrible. This is the worst place. And then the family leaves, and the person's fine again. I've seen that a lot. It's not something that you should be feeling guilty about. It's just because that's what happens. They see you and they're reminded of home, and then they want to go back there. People with dementia typically cannot care for themselves. So leaving somebody at home and saying, okay, well, mom's fine, I stop in, I live near, a lot of people will say to me, well, I live nearby. I stop in and I see her. Okay, but what about the other, 20 hours that day? So the first thing we're really going to discuss in any detail is in-home care with a family or within care services. A lot of people, because they feel guilty, will wait and have like they'll take care of the person themselves, or the family will keep taking care of them. But again, it's really, really hard to take care of somebody yourself 24 hours a day, because you're not two people. You're just one person. Um, I recommend in-home care services and getting them 24 hours a day, or mixing it up so that you're there part of the time and in-home care is part of the time. A lot can happen in a short amount of time. And I want to emphasize the fact that, um, you know, having Life Alert, or having a video monitor, or having some other sort of technology is not going to solve the problem. So I was helping this one woman care for her father, and she said, "Oh, well, I know I'm not here all the time, and I don't have home care, but all the time, but Dad has Life Alert." And I looked at him and I said, "What would you do if you fell?" And he was a very pleasant guy, and he said, "Well, I guess I'd yell very loudly." And I said, "Okay." So the daughter was like, "Well, Dad, what about that thing on your neck?" And he was like, "What do you mean?" I mean, so he really, having Life Alert for somebody with dementia a lot of times doesn't really work, because they don't know what it's there for, and they're not going to know to press it if they fall. The other thing with Life Alert is that if you fall, no matter who you are, if you fall and you get knocked unconscious, having Life Alert really isn't going to help you. So I know I'm kind of sarcastic about technology at home. I love technology. I'm in my late 20s. I love tech. I love walking around the Apple store for hours on end. But tech is not going to solve the inherent problem of dementia care, which is that people need people to help take care of them. And having a video service, set up, or a monitoring GPS or whatever, is not going to solve the inherent problem. Daycare. I mentioned this. Having daycare, I think, is a great option. A lot of people don't recognize it as an option. And I think it's really nice because you can actually drop off that person during the day. So it's respite care during the day, which is great, because if you spend the night at home and you want to take care of your loved one at home during the evening, wonderful. You can go pick them up and bring them home, and then they're home with you. So that's a really nice option. It's not as common as assisted living, personal care, things like that, but it is absolutely an option. And I think for a lot of people, it's an option that people don't think of. So to Google, in your area, daycare, adult daycare, and see what's available, because it is a really nice option. The problem with daycare is that if you have somebody who doesn't like to leave the daycare, or does not like to go to the daycare, doing that battle every day is going to get really old. So I think it's important to know, know your loved one. Now, assisted living, like I said, called personal care in some states. Technically, they are different, but honestly, I don't know how, because they seem pretty much the exact same to me. So trying out an assisted living community, I think a lot of people start thinking about this and they panic about what to do, when to do it, how to do it. Choosing an assisted living community can be really challenging, and that's actually pretty much a lot of what my book is about. And when you're looking for a care community, you not only want to look for one that's close to you, but also one that fulfills, the needs of your loved one. The other thing that you want to look for is a community where other residents are similar enough to your loved one, so that they're not going in there and being a completely different. Everyone isn't much lower functioning than them or much higher functioning than them. And then, of course, you've got memory care only. So some of those newer communities that you're seeing pop up are standalone buildings for dementia care. The problem with some of these buildings is you need to look at the company that owns them. I say this because there's a lot of companies now who own these buildings, who work in like building, and they don't necessarily work in dementia care. You really want to find a company that specializes in dementia care. Arden Courts is a good one. I've been talking a lot to Artis, ARTIS, Senior Living, companies that specialize in dementia care and have these standalone buildings. You really don't want to find a building where somebody has just kind of set it up as a cash cow, thinking like, okay, dementia care is the new thing. We have architecture experience. We don't have any dementia experience. We're going to build this building. And they really don't know anything about dementia care. So that is my quick thing on dementia care only places. Make sure the company that owns them actually knows what the heck they're talking about. And then, of course, a skilled nursing facility, like I said, often referred to as a SNF. SNFs will take people on Medicaid. They're typically for short-term rehab. If you have a loved one who's fallen, they might have gone from the hospital into a SNF. You can also live full-time in a SNF. It's typically for people with a little bit more in the way of physical need than it is otherwise. Typically, SNFs look a little bit more hospital-like because they are kind of that post-acute space. So they do have more of a hospital feel than assisted living or personal care. Okay, how do you choose a community? So we're going to hop right into that. Your gut feeling. This is really important. This is how I picked a university, my undergraduate university. I got to campus and I just had a good feeling about it. You really need to have a good feeling of the place. I mean, I don't expect you to be thrilled. Okay, you're probably not going to be super pumped about choosing a community, but you do need to feel like, okay, this is a good place. What does the community look like? What does it smell like? There are going to be days in senior care communities that the community doesn't smell great. That's just a reality of having a lot of people in one spot, especially a lot of people who don't always have the best hygiene practices. However, overwhelmingly, the community should look clean, smell clean, and you should be able to walk around, see people smiling, see people laughing. It should not be a dead zone. It should also look different times of the day. So maybe go visit a community in the morning and then go visit the same community on a different day in the afternoon. You're going to experience different things. Visiting communities in the afternoon, probably not a great idea. A lot of people with dementia tend to sundown. They tend to get a little agitated in the afternoon. Things do not go as well in dementia care in the afternoon. So if you want to get a good look at a community, check it out in the morning and in the afternoon to get a full picture. How is the food? A lot of communities actually allow you to eat there for free when you go to visit, like just a one-time free meal. So if you go to visit a community, say to the marketing director, we'd like to come eat a meal there. And what you can actually do is bring your loved one with dementia. Plan ahead of time, bring them to lunch. Don't tell them, hey, we're going to go look at this care community for you to live in now. We're just going to go eat lunch somewhere. Bring them with you, go eat lunch there, see how well they do, see if they interact with other people, see how you feel about it, just generally see how the food is. How is the activity calendar? In some ways, this is almost like choosing a college, just less fun, but also still expensive. So how is the activity calendar? Is there stuff going on the calendar? Are there plenty of options? Are there outings? Is there entertainment? Are people coming in playing music or dancing, or what's going on? And is the stuff on the calendar actually happening? If it's 10:30 in the morning and you see that there's supposed to be exercise happening, and every day you go visit and there's no exercise happening, that's a problem. How is the staff? Does the staff look agreeable? Are they happy to be there? Are they talking to residents? Do they know them as people? The person in charge, the executive director, you should like the administrator or the executive director. If you do not, you won't like the community. The executive director or the administrator has a lot of power over the way the community goes day to day. And if you don't like them and you don't trust them, don't move your loved one there. What do families say about it? Grab a family member who's walking out the door and ask them, what do you think about this place? Do you like it? What are your complaints? What are the good parts about it? Ask other people who are there. There are always going to be people who don't like stuff, so you can't base it off of one person, but you know how it is. If you're reading Amazon reviews, you want to read a bunch of reviews. You don't want to read just one review. what do the online reviews look like? So if you look on caring.com has a lot of information about different care communities. See what those reviews look like. But bear in mind, the people who are the most happy and also the people who are the most angry are the people who are going to be posting. So you do want to ask people in person as well and get kind of an unbiased approach. What does move-in day look like? If you're thinking about moving somebody with dementia, you really need to plan ahead of time. It's very, very important to go in with a plan. Like I said, know what type of person your loved one is. Are they the kind of person who's going to want to check this place out? Are they the kind of person who's going to want to have some say in the move? Or are they the kind of person who's going to freak out if they find out they're going to be in there? Are they a social person? Would they like to share a room with another person? What kind of person are they? Are they an extrovert? Are they an introvert? What kind of person are they? Also, to plan ahead of time with paperwork. I can't tell you how many move-ins I've seen start out well and then go poorly because people are doing paperwork the day of. If possible, go to the community a couple days ahead of time, bring all the, bring that person's ID and bring their medical paperwork and bring all this stuff and get it filled out ahead of time. And that way, when you bring your loved one there for the first day to bring them in, drop them off, you're not sitting there filling out a bunch of paperwork, because I promise there will be plenty of paperwork for you to do. Try to schedule it with the marketing director to do it ahead of time. Know what they'll need. Like I say, pretend it's like college. Find out what they're going to need. Does the community supply towels? Does the community supply wipes, gloves, adult briefs? Do they supply toilet paper? Most likely, yes. But you do want to find these kinds of things out. What do you need to pay out of pocket for? What is going to end up on your bill? How is their medication getting delivered? Do they have a service for that? How does it work? Go in knowing what they'll need. I also can't tell you how many move-ins I've seen where the family was not prepared. Person got dropped off. We've got their clothes in a garbage bag, and we've got a couple toiletries in a little bucket, and that's all we got. That's really not a great way to start a move-in. You really want that person moving in as if you're not going to see them for a few more days. You want them to have everything they need. Make it an easy transition for everybody. Have a plan. Do not tell them that this is where they live now. Please, please do not do that. Unless for some bizarre reason you think that your loved one can handle it. I don't think that they can. Most people do not want to hear you tell them that this is where they live now. That is going to really mess up, that's really going to mess up their day. What you can say instead is, you're going to be here for a little while. You're going to be here until your whatever gets better. Don't say your brain, say your leg, your arm. What if they have a physical ailment? Point to that and say the doctor wants you to be here until your arm isn't broken anymore, or until your ankle heals, or whatever. Blame it on something else. Do not tell them that this is where they live now. That is the worst thing that you can do. It will cause so many fights. I've seen people visit their loved ones and they'll go and say, well, Mom, don't you remember? Your room's right down the hall. This is where you live now. No, 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 no. I have watched that result in so many drop-down, drag-out fights because they don't believe you. They don't want to believe that this is where they live now. They want to live in a house that they've always lived in. And a lot of times, the house that they want to live in is the house that they grew up in. So that's the other problem that you're going to encounter, is they're going to be asking for a place. They're going to say, I want to go home. And you're going to be dealing with some of that. Do not run out the door.
Excuse me, everyone. We're just having a minor technical difficulty. I think we've got a computer issue on Rachel's, and so please bear with us as we go ahead and just power up. Again, we do apologize for this brief momentary situation here. We'll be back up and running in just one moment. Thank you.
Yep. Okay, am I back? Am I back?
Thank you so much. See everyone, thank you so much for your patience as we just powered up. Rachel, you are good to continue.
Cool. Okay. So do not run out the door. I have literally watched people run out the door. That is not something you really want to do. It is going to cause a serious problem. I actually watched a family one time tell their loved one they were going to the bathroom and then just bolt. Like they literally ran. And of course the residents saw them running and a chase ensued. It was a really bad situation. You don't have to run out the door. You can get your loved one involved in something. You can get them interested in doing something, and then you can quietly leave. You can also say to them, we'll be back later. You don't have to say we're going home. Don't say that. Say we'll be back later. That's fine. You will be back later. And of course, the inevitable thing that you're going to have to deal with, which is the I want to go home now. Don't panic, because transitions take longer for people with dementia. Many people with dementia take a long time to adjust. Maybe it's, 3 days, maybe it's a week, maybe it's 2 months. It really depends on the person. Like anybody, if you're moving, you're getting a new house, and you just moved to a new neighborhood, you moved to a new state, it's probably going to take you a while to adjust, right? People with dementia are the same, except it might just take them a little bit longer because the changes, all the changes that have been made. But it's really important to not panic about this. I've had people say to me, well, mom's not doing well and I need to move her out. She's been there for a week. It's like, being somewhere for a week is not enough time to really actually see if it works. If you moved in, when I went to college, it took me about a semester to get used to being far away from my family. I think it's important to know, know your loved one, know how long it's going to take. So again, do not panic. And again, please don't tell them this is where you live now. Even when you go to visit, it's not gonna go well. A lot of times people with dementia live in a kind of a different world than we do. They believe things that aren't true. Okay, and that's all right. Correcting somebody with dementia is going to get you into way, way, way more trouble than if you just let them live in their own reality, which is a phrase I have called embracing someone's reality. Embracing somebody's reality means you get into their world and stop trying to drag them into ours. Telling somebody with dementia this is where you live now is a real shock to many people who think that they're still 25 years old and, live with their new spouse or what have you. A lot of times they very much live in a different world. Avoid the word home. So when you go to visit, do not say, okay, hey, it was great seeing you. I'm going home now. For a lot of people, especially for people with spouses in the community, spousal relationships become very strained because it will be very confusing for families. They'll say, oh, I'm going home now. And of course that resident says, okay, well, let's go. I'll come with you. And then you get into the whole issue of you can't take them. I watched this married couple fight every day at my community. They fought every single day because the woman lived there and the husband would come and visit. And at the end of the day, he would always say, okay, honey, I'm going home. And she would say, great, I'll come with you. And then he would say, no, you can't. Your room's down the hall. You live here now. And they would get into this huge fight every day. I think he had a little bit of dementia as well because I was trying to show him like, okay, maybe we should try something else. And he could never remember to do this. But they fought every day. And it was such a shame because they had such a wonderful visit beforehand. But you know, just the fact that he kept saying, like, I'm going home, really set her off. Because when somebody says they're going home, they're like, okay, I'm coming too. Bring activities to do with your loved one. So bring something from home. Bring, you know, people will say to me, well, I don't know what to do when I go visit my loved one. What do I do when I get there? You know, it's boring. We don't know what to talk about. Bring something to do with you. You know, maybe even if you bake some cookies, you're going to bring them some cookies from home. Great. You know, bring something to do. Bring a plan, and bring a leaving plan, so that you're not just going, okay, here I go, I'm leaving, I'm running out the door. You can get that person involved in an activity. You can get them to do something before you go. Find a way to engage your loved one in something before you leave. Bring them to an activity. You know, maybe plan your visit so that an hour after you get there, lunch is starting. Great. You know that you can bring your loved one to lunch. Wonderful. Bring your loved one to lunch, set them up, get them set up at the table, and then you can leave. You can't stay there all day. Don't guilt trip yourself into staying there all day. You really want your loved one to get used to being somewhere. And if you're there all the time, it's not really going to help them adjust. You also want to allow them time to meet other people and engage with other people. I have seen some of the most beautiful friendships come out of dementia care communities. People love interacting with people at their same level. So if you have two women who are both in their 90s and both have Alzheimer's disease, and maybe they're at the same kind of level of Alzheimer's, that might be really nice for them to hang out together. You know, they have things in common. They don't recognize each other's deficits. So when one's repeating a couple words, the other one doesn't point it out. You know, she doesn't point out that a couple words have been missing. They're at the same level. Nobody feels like they have to ask. They have to act a certain way. Also, knowing what time of day is best to visit. You do not want to, most of the time you don't really want to visit after like 2 o'clock, really. It's probably a good time. Visiting in the afternoon, people are usually way more agitated in the afternoon, so you really do not want to visit during the time of day where they're going to be really agitated. Probably not a good way to do it. Like I said, again, feeling guilty is not a good reason to not make this kind of transition. You really want to do the thing that is best for your loved one's safety and for their health. And for a lot of families, that thing is care community living, is moving them to a care community. And I think that's a really, you know, it takes a lot of courage for a lot of families to make that transition, especially when their families have made it, when their family members have made it clear that they don't want anyone to be moved. The other thing that you may deal with is that you've chosen to move your loved one into a care community, and then your cousins from out of town show up. Oh, they have a lot of opinions. They've got a lot of opinions, and they come to you and they say, well, you know, Aunt Susie doesn't seem that bad. You know, her dementia's not that bad. I don't know why you moved her. You should just be taking care of her at your house. You just need to take care of her at your house. And here's what you can say to those people. Here's what you can say to your cousins. You can say, you know what? That's an interesting thought. Why don't you come and take care of Aunt Susie all day, 24 hours a day, 7 days a week, for the rest of time? I guarantee they won't want to do that, but they will want to make you feel guilty. They will put the blame on you and make you feel like you're a bad person for deciding to move your loved one to a care community. And I'm here to tell you, you are not a bad person for deciding to move your loved one to a care community. You are doing the thing that many people cannot do. You're putting yourself aside and you're saying, what's best for my loved one? And for many people, what's best for them is living in a place with other people with dementia, and a place where they can get 24-hour care, and a place where you're not exhausting yourself having to take care of their every need. You can still be a very involved caregiver and visit them a few times a week. You can still be very involved in their care. Just because you're not there 24 hours a day giving them a shower and making sure they're fed doesn't make you less of a caregiver. It just makes you somebody who, you know, has made the decision to move their loved one into a care community. So here are some ways you can contact me. I'm going to answer some questions. I have my website, rachelwonderland.com is my portfolio website. Dementia by Day is my blog site. I write on there very frequently, twice a week or so, and I answer questions from readers, and I also post new information about dementia. And then, of course, my other website is Designing for Dementia, so if you're interested in interior decorating related to dementia care design, which is one of my favorite things, you can check out that website. I work with an interior designer out in Wisconsin who specializes also in dementia care, and she and I have teamed up to create this website, and you can actually see some of our work there. And of course, if you have any questions, email me. That's my email address. Send me your questions. The other thing that I offer is I actually do phone calls. So I can talk to people on the phone for up to an hour. It's $25. You can pay on PayPal. I'll set up a time to call you and we'll talk for an hour. You can tell me all of your dementia-related concerns and questions, and I'll do my best to personally troubleshoot and answer them for you. And that's available through my rachelwonderland.com website, or email me and I'll send you the link. But that's what I love to do. I love problem solving. I will help you walk through whatever you need walked through, especially when it comes to thinking about moving somebody. What's one of the biggest questions I get is, okay, I'm thinking about moving somebody. How do I do this? When do I do it? Why do I do it?
Well, wonderful. Rachel, thank you so much. This is Molly, the AFA's Director of Education and Social Services. We've got a bunch of questions here for you, so I'm going to just go ahead and jump on in for you to answer.
Yeah.
So a few different points that our fantastic care community have put out here. A day program provides respite for both the caregiver and the person living with dementia. And this is from Gail. Thank you so much, Gail, for any clarification you wanted to add here. The staff can help with getting an individual who's living with this illness there and then getting them home. And so an opportunity to just expand on programming and awareness of the roles that people have in different facilities. We have something from Wendy, who's saying that she is a placement advisor for Care Patrol, a franchise in the Miami area, saying that we should mention that skilled nursing is for medical care and assisted living, for help with the activities of daily living and memory care is specific to memory issues, with a major difference being the attention to wandering issues. And then she added something else. Thank you, Wendy, for all of this clarification or addition that you wanted to add for us today. Also in Miami, we have cultural issues. So true, cultural competency is really important. So Wendy says she finds places for people based on their needs, preferences, and finances. I would never match a person with a place that speaks a different language. You must be able to communicate with your caregivers as well. So important, something that I know that we mention quite a bit within our Partners in Care training and on our helpline as well. Wendy also says that there's a lot of different ways to pay for assisted living and memory care, including VA benefits, federal Medicaid programs specific to assisted living, using long-term care policy, and using proceeds from the sale of a home. You can also use life insurance to pay for assisted living, and it will still pay a death benefit. So thank you so much, Wendy. This is the greatest thing about our Care Connection webinars. We have such an excellent group of care professionals sharing their feelings, comments, and their expertise too. So thank you so much, Wendy. There's one other question here. Give us just a moment. You guys are really, really active today. So assuming you are the spouse, this is coming from Susan, assuming you are the spouse and going home, what do you say to your loved one? I wonder if I am making a wrong move. I try to go over around 9 p.m. most nights to say goodnight. He is alert enough to know when I leave. That's a great question, Susan. Rachel?
Yeah, that that feels like it's probably really hard for both of you, going over at night to say goodnight. If it brings you both comfort, I say absolutely, 100%, keep doing it. I imagine, if I put myself in your shoes, I imagine that would be really hard for me. So it's really up to you what works well for you. When you're leaving, no matter what time of day you're leaving, I always try to say, like, I'll see you later, I'll see you tomorrow, I'll be back soon. And that way you're not saying, okay, I'm going home, okay, bye, I'm leaving. You can just say, okay, I'll see you again soon. I'll see you later, is really how I would leave it. And again, I guess it depends how alert he is, but I don't know how he responds. I mean, if he's responding fine, if you're saying, hey, okay, I'm going home, I'll see you later, and he's like, okay, bye. If that works for you, that works for you. Overwhelmingly, I've found that people don't respond well to that. But of course, if he's fine with it, it's okay. You got to find that middle ground where everybody's happy, and sometimes what works for one couple is not going to work, not going to work for another. But I would recommend just not even using that word home and visiting earlier. If it were me, I'd visit earlier in the day and avoid that nighttime thing. I think that'd be hard for both of you, but that's
Sure.
really personal.
Thank you, Rachel, and great question, Susan. We find that, as Rachel mentions, every single person is their own unique, has their own unique set of needs and thoughts and feelings and patterns. And so, with our highlight on our philosophy of care and person-centered care specifically, as Rachel mentioned, you guys have your groove, and that if that's working for you, even when it is challenging, if it's useful, we strongly recommend that you continue to, do what works best. And whether it's also reaching out for support in local support groups, AFA also has our national toll-free helpline with licensed social workers, as well as supportive services that can assist you with any challenges that may arise with you and your partner. So thank you so much for bringing that up. More questions. So finding affordable care for facilities, too expensive for many seniors and their family members. Any suggestions? Great question, Mara.
What did she say?
Questions about finding affordable care facilities. Because it can be really expensive for many seniors and their family members.
Really depends also where you live, which is one of the things people said to me, well, you didn't write down any good care communities in your book. It's like, well, no, because it really depends where you live. So if you're in like the District of Columbia, your rent could be over 10 grand a month. And if you're in like Greensboro, North Carolina, which is where I moved up here from, your rent would be closer to like 4 grand a month. So it really depends on the place, on the state that you're looking in, and the city that you're looking in. I would call like a placement agency, see if you have a reputable source, see if you know anybody in the area too who's moved a loved one, and if they have any recommendations. You can kind of cheat a little bit and see some of your homework might be done for you by hopping online or finding a friend who you know has moved a loved one and say like, okay, what places did you visit? How much were they? The other thing you want to do is be upfront with the marketing director when you go to move somebody and say, look, this is how much money they have saved up. Here's what I have to work with. What happens if we run out of money? Is my loved one going to get kicked out? Are you going to be able to flip us to Medicaid? Are you going to be able to reimburse us in some way? Are you going to be able to help us at all? So knowing what the community is able to offer you as well, and I think being upfront and not just saying, oh, we got plenty of money, we're fine. Really being honest with the community. They're not out, before you move in, they're not trying to gouge you, So work out a deal before you move.
Great. Thank you so much, Rachel. And Mara, our national toll-free helpline is also a great resource. As we are a national organization, we're happy to help you find resources and strategies to help afford care in terms of care settings or care in the home or anything specific to your needs. So do feel free, Mara, to give us a call at 866-232-8484 and talk to any of our licensed social workers on the line for further assistance. So another question. Thanks so much, Angelica. We've got your question here. Are there any general recommendations once a person is placed to not visit for some time to allow the person to adjust? So,
allowing the person, yeah.
Yeah.
Well, I feel like I want to read some of these too.
Is there any general recommendation once a person is placed to not visit for some time to allow the person to adjust?
No, it really depends on the person. It really depends on the person. I would say that some people visit the next day. Some people visit immediately. If your loved one is going to take some time, yeah, give it a week or so. But there are people who are used to seeing their loved ones every single day, and if you don't go in, they're going to be upset. So no, there's no general rule. I would say just go visit as much or as little as you want, really is the answer. But do what is best for you and your loved one. If you find that they're not able to adjust because they keep seeing you, then maybe hold off a little bit.
Excellent, great, thank you so much. Yeah, we agree. We want to make sure again that it's making, like Rachel's saying, that we're ensuring consistency is key and we're maintaining the normalcy and the structure in a person's world. Gail, thank you again for adding to this. What we would suggest is to take them to an activity in the facility and then leave, in terms of perhaps testing out a facility or testing out the community to see if it is a good fit. There is also a discussion about memory cafes for anybody who's on the line who might be interested in terms of extra support. The memory cafe can be really useful. We've got also, Wendy added some more information. The average cost of assisted living in the U.S. is about $3,000 per month. That includes food, caregiver, and everything. Memory care is higher. Medicaid benefit may be about $1,200 per month. Thank you again, Wendy, for being a fantastic resource for us here. I wanted to also let folks know, as we've got a few more questions coming on in, that part of what the Alzheimer's Foundation of America's Partner in Care training does is assist individuals in learning, care professionals as well as family members, in learning strategies to assist with behaviors, really exploring behaviors as a form of communication, and offering other clinical strategies and interventions to assist with how we can better understand and communicate around these unmet needs. And so anybody who's interested, of course, you can always reach out to us, and we'd be happy to share more information about our training with some of these topics that have been discussed today. And so, Rachel, there's another question about memory cafes. I'm not sure if you're familiar with memory cafes, if you want to speak about that a little bit.
Sure. So memory cafes, depends on where you're at, but different memory cafes are like places where people with dementia can go along with their loved ones. So you can actually, it's almost like going to support group, but you can actually bring your loved one with dementia. And usually there's activities there, there's other people with dementia, and you get to talk to the families, and they get to talk to other people. The Penn Memory Center in Philadelphia has a really wonderful one, probably one of the first and biggest ones in the country. And I work with one here in Pittsburgh as well. It's a pretty cool program, and it's usually free, and it's just a nice thing to be able to connect with other people who are going through the same thing that you are.
Great, thank you so much. And we're also happy to help find anybody a memory cafe or any other resources within their area because they are truly, truly wonderful. Any other questions from folks today? I see, Risa, you've got a question about your family caregiver. Your mother had a stroke a few years ago. Your father's the caregiver. Mother's recovered, and some of her functions have recovered as well. Some walking issues. My mother wants to go to activities, but my father prefers to do nothing except go to doctor's appointments. I've suggested hiring a person to drive mom to activities, but father said he would take her and doesn't. Very frustrating and worrisome because my mother needs the interaction. What should I do?
Okay, yeah, I'm looking at this question as well because it's longer. So, yeah, I would recommend, I'd recommend adult daycare. And at least then, even if you took your mom for a couple hours a day, she could go and hang out with some people who are at her level. Yeah, he said he would take her and doesn't. Okay. Yeah, I mean, you can actually arrange, if there's adult daycare, you can actually arrange for like the access bus or the access van or whoever, is in your area, a car to come and pick her up and take her to the daycare for a little bit. That might be nice, and she can actually do things that are at her level and hang out with people and not just be with your dad. A lot of times I see spouses almost kind of do more damage to each other than they intend to, because they'll cover for each other. So if one spouse has dementia and the other one doesn't, the one that doesn't have dementia will cover for the other one. They'll kind of fill in the gaps, and if they're apart, or if the one spouse dies, the one with dementia, it becomes very clear how impaired they actually are. Spouses will also hold each other back a little bit, like, oh, well, she doesn't want to go to activities. Well, she does, but he's not letting her go. So, yeah.
Great, thank you so much. So while we wait, we've got just a few more moments left while we wait for the next few questions to come on in. Rachel, do you mind just forwarding the slide 1?
Sure.
Thank you. So for those of you who might be new to AFA and new to our Care Connection webinar, we thank you. For those of you who are returning, we're just really happy that you're here. Actually, the second to last slide, Rachel. Thank you so much. And so, as I mentioned, we have our national toll-free helpline that's available for you as a resource, whether it's you personally or you professionally, to help answer any questions that you may have at any time in between our Care Connection webinars. We have our Dementia Care Professionals of America program. This is our training and certification program to help build those skills and strategies so we can best work with our individuals who are living with this illness, ensuring meaningful living and quality of life. And this is coming from a person-centered perspective. We have our Educating America tour celebrating our 15th anniversary. We are about to ramp up for the second half of the year, with the next one starting up September 14th in Washington, D.C. We'll be in Durham, North Carolina, Long Island, New York, Indianapolis, Chicago, and Boston. So definitely check out our website for more information. We have our National Memory Screening Program to assist folks with early detection, which is wonderful. We also have our Excellence in Care Program of Distinction, which is great and really relevant to the topic today. It's a program that we have available to ensure that facilities are providing best practice in care. They can receive our certification of distinction through a comprehensive evaluation. So we have these listed on our websites, and if you're a care setting who'd be interested, you can always give us a call. Our webinar that you're joining today, that Rachel's been gracious enough to share her knowledge and expertise with us, we do greatly appreciate that. And then we have a few other questions that are coming out. So again, Gail is providing us some more information. ADC has been provided to couples in assisted living. If they both have dementia, then one can go to the ADL and give respite, and the other will provide a spouse a break. What is a good thing to say instead of, do you remember? Particularly when the person comes back with, well, why didn't you tell me, in an angry way? Great question, Lillian.
Yeah. Yes, using the word remember should only be used in a long-term scenario. So if you're saying, like, oh, do you remember where you met your husband? You know, you can talk about that. Even long-term you can talk about, but using do you remember in a short-term thing is not a good way to do it. Just repeat it, you know, and when someone will say to you, well, why didn't you tell me about that? Of course you told them, but they don't remember. So you can say, oh, I'm sorry, it must have slipped my mind, I'm so busy, here's the information again. And yes, are you taking the brunt of the anger? Sure. But it's much easier to apologize, even when you know it's not real, and to just move on and just repeat the information again, because they're not going to remember. They're not going to remember you told them. You can put it on a calendar, you can write them a note, you can do whatever you want, but they're not going to remember. And sometimes it's just easier to say, oh, I'm sorry, I must have forgotten to tell you.
Excellent, thank you so much. Rachel, is there a checklist that you have available to hire a person to help? Do you have any recommendations?
To hire a person to help, like a home care agency?
So is there a checklist available to help when you're hiring a person to help with a person who's living with dementia?
Like questions that that they should
a checklist available, things that you want to make sure that you know, whether it's about the person or things that you want to make sure that you're aware of.
They should know how to talk to somebody with dementia. They shouldn't be correcting people with dementia. They should be able to embrace their reality. They shouldn't be arguing with people with dementia. They should have worked with people with dementia before, but not only that, know how to do it appropriately. It's really hard to hire people individually because a lot of times people will be flaky and you'll miss a caregiver and then you're on the hook again to find somebody else. I recommend hiring a home care agency because if one of their people can't make it, they find somebody else to go instead. So looking for a home care agency that specializes in dementia care.
Great, thank you so much. And again, we strongly encourage to be working with licensed caregivers, and as Rachel mentioned, folks who have previous experience or training, and that's something that we can absolutely help you with as well, finding a trained caregiver, finding one of our member organizations who can provide that in your area. And so with that, we want to say thank you so much to Rachel and for all of you for joining us. This PowerPoint presentation and some other resources are available on the right-hand side panel where it says handouts for you to download. And if you have any other questions, you have Rachel's information, you have our information here at AFA, and we look forward to seeing you next month. Thank you so much, Rachel, again, for sharing your expertise with us all today. We do appreciate it.
Yeah, no problem.
All right, fantastic. Have a great day, everyone.